Hi guys, thanks again for watching and another video on our Ask Dr. Sammy from the different social media platforms. Today's question is, this particular owner has a small breed dog and they want to know if vomiting is okay every now and then. That is a loaded question. There's a lot of variabilities with that. There's a lot of different answers and it depends on some of those more finite answers. So if your dog goes out and eats grass and then throws up shortly after, I personally am not too worried about it. Grass can be a little irritating to the stomach and commonly will stimulate them to vomit shortly after. Or if they drink a lot of water, then they tend to fluid overload the stomach a little bit and cause them to vomit. So if that's the every once in a while and that's the situation that it's happening on, me personally, I'm not typically worried about those. There are exceptions with everything and I need a whole clinical picture and clinical history to kind of formulate the differentials and the diagnosis and things like that. So can't directly answer that question because every patient is different and every situation is different. But if your patient's throwing up, 5 times a day for a few weeks, yes, that's abnormal. Most people know that, understand that, and realize that. If they're throwing up once a week, that's still a little too frequent. I would pay attention to it. Once again, there's a lot of other factors that come into play with that. Are we eating and then running and playing? Are we a large breed? Are we a small breed? What's our age? Is underlying cancer on my list for stomach cancers, different issues like that? Do they get a lot of table food? Those can all be reasons for this intermittent vomiting. So answering the question with, is it normal for my pet to vomit occasionally? A lot of pets vomit occasionally, once a month, once every few months. That we're usually not too worried about. All depends on the history and the clinical signs. But if they're throwing up frequently after every episode of something, I usually look for a problem. Great example is today I had a patient who's been vomiting for the last 3 weeks intermittently, and now we've progressed to the point where we're even vomiting up water. So in those cases, I'm going to be looking for foreign bodies. There are some pancreatitis and other GI issues that can be predisposed to with that presentation, but I usually try and stick with the most common things first, and then as we eliminate the most common explanations, then I'll tend to get a little bit more aggressive, more detailed with more targeted with my diagnostics and issues. So hope that helps clarify that a little bit. Can't answer it directly because there's just too many variables with that, and without those other variables, it's really hard for me to give a straight answer. And there's not a straight answer. It's all situational and how the patient's presenting. So hope that illuminates a little bit on that situation. I will extrapolate a little bit to the feline community. And for the feline community, what I want you to pay attention to a little bit more with this intermittent vomiting or hairballs is another one that feline owners will commonly say. If they are having hairballs or vomiting episodes more than once every 3 months, that's a little more frequent than the normal average patient. So if they're doing it once every 2 weeks, once a month, that is too frequent, and there are some common differentials that we look for that 95% of the time they are positive for one of the 2 or 3. So hope that helps you guys out a little bit. Be safe, and we will see you around. Bye guys.